Some people scroll TikTok or Instagram on their phone, but here I am obsessively tracking my weather app to see if it's cool enough to wear my new favorite item, a gorgeous cashmere sweater that I got from Quince. Now, I've been eyeing their cashmere for a while, but kinda didn't believe a quality cashmere item could be priced so low. But I decided to go for it, and I can tell you, this sweater is absolutely divine. It's a navy blue boat neck sweater with lovely drape, and I'm telling you, I'm going to be wearing this thing everywhere this fall. Going to the grocery store, wearing my sweater. Taking in a Pilates class, I'm throwing the sweater on before and after. Out for a date with my love bug? Yep, blue sweater. Recording for the podcast? Guess what? I'm wearing it right now. Here's another thing I love about Quince. Not only do they work directly with ethical manufacturers, but they pass all those savings onto their customers. So I can get gorgeous Mongolian cashmere sweaters, cotton cardigans, and even super soft denim at a fraction of the cost. 50 to 80% less than similar brands. And now that I say that, I realize I gotta get some more of these sweaters. Get cozy in Quince's high-quality wardrobe essentials. Go to quince.com/nursemo for free shipping on your order and 365-day returns. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Well, hello. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in school and at the bedside. Today, we are talking about a med-surg topic in a category I get asked about all the time. I get a ton of requests to talk about different cancer treatments, cancer conditions, all of that. So we're diving into prostate cancer today. Before we do that, let's take a quick minute for our listener shout out, which goes out to Lena, who says, "There's no way I would have mastered the dosage calculations without Crucial Concepts Bootcamp. It was a huge source of anxiety for me, and now I look forward to math questions on exams. Thank you, Nurse Mo." Well, thank you, Lena, for sharing your experience with bootcamp and how the lessons on dosage calculations have eased your anxiety and even made you look forward to doing them. I'm so proud of you. Alrighty, if you're curious what Lena's talking about, she's talking about my nursing school prep course, Crucial Concepts Bootcamp. I will put a link to that in the episode notes, or you can just go to my website, straightanursingstudent.com, click on courses in that top menu bar. Alrighty, so prostate cancer is the topic today. And prostate cancer is a condition in which a tumor develops in the prostate. In some cases, that cancer metastasizes or spreads to other areas of the body. And when this occurs, it most commonly spreads to the lymph nodes or the bones. It is a leading cause of cancer among men in the United States, though the good news is that it is a very slow-growing cancer. In fact, it is so slow growing that a lot of men just die with prostate cancer, not because of prostate cancer. And there are quite a few treatment options available. So first, you might be wondering, who is at risk for prostate cancer? So individuals most at risk are going to be males between the ages of 65 and 74, though of course it can develop in younger individuals. Unfortunately, it is not at all uncommon, with 1 in 8 men in the United States being diagnosed with prostate cancer at some point in their lifetime. In addition to having that family history of prostate cancer, other risk factors for it include presence of the BRCA1 or BRCA2 genetic mutation, being of African American ethnicity, consuming a diet high in animal fats and or low in vegetables, being exposed to chemicals and pesticides, and exposure to Agent Orange, which was a chemical herbicide used in the Vietnam War. So now that you've got a little bit of background on prostate cancer, we're going to dive into the key things you as a nurse or nursing student need to know using the straight A nursing latte method. So that's LATTE. So the first letter, which is L, stands for look. How does this patient look? In other words, what are the signs and symptoms? So in many cases, a patient with prostate cancer can absolutely be asymptomatic, especially in those early stages. When symptoms do occur, like those early symptoms, they're going to look a lot like BPH or benign prostatic hyperplasia. This is going to be things like nocturia, frequent or urgent urination, that slow urinary stream or an intermittent urinary stream where it stops and starts. The urinary stream could be split and there could be dribbling of urine. So those are kind of common signs of BPH, and you could also see them in that early stage of prostate cancer. Other signs and symptoms include an enlarged prostate, hematuria, which is blood in the urine, incontinence, erectile dysfunction, weight loss and weakness. They could even have blood in the semen or bone pain if the cancer has already spread to the bones. Now, the next letter in the latte method is an A, and that stands for assessment. So, how are we going to assess our patient? So, priority assessments for a patient with prostate cancer a lot of them are going to revolve around bladder habits and for the presence of urinary retention, which can lead to urinary tract infections and even renal damage. So, urinary retention or post-void residual or PVR can be assessed either by straight cathing the patient after they have voided to see how much urine comes out, or with a bladder scanner. So let's say we're going to use the bladder scanner way, which is the most common way. We're going to have the patient void and then have them lie down in a supine position. Then we get that ultrasound gel, place it on the suprapubic area, and then we get that ultrasound probe, place it on that gelled area and aim it toward the bladder. Then you press the button on the ultrasound probe and the volume that's in the bladder will show on the visual display. And typically what we do is we take like 3 measurements because it really can be dependent on how you position the probe and the angle you're aiming it. So we take 3 measurements and we take the largest one as our post-void residual, or how much urine is sitting in the bladder. A normal post-void residual is around 12 mils. When we're looking at volumes over like 250, this is concerning for significant urinary retention. And then, of course, assessments are going to vary pretty widely depending on what treatment path the patient is on. You know, they could go through chemotherapy, radiation therapy, immunotherapy. So assessments are going to be more specific based on whatever treatment path they're going through. For example, a patient going through chemotherapy can have significant side effects that we're going to watch for, like nausea, vomiting, weight loss, and oral mucositis. So the next letter in the latte method is a T, and this one stands for tests. What tests are going to be utilized for a patient with prostate cancer or suspected prostate cancer? So the PSA test is probably the one that you have heard the most. And this is going to be that main test for prostate cancer screening. And PSA stands for prostate specific antigen. And it's going to be elevated in prostate cancer. But guess what? It's going to be elevated in some benign conditions as well, such as BPH or even an infection. In fact, studies show that approximately 75% of men with an elevated PSA do not actually have prostate cancer. It's elevated for some other reason. So it's not diagnostic for prostate cancer, but it is a screening tool. So if we have an abnormal level, what they'll typically do is repeat the PSA a few weeks later to see if it remains elevated. Now, it is important to note that PSA does increase normally with age. So, for example, the normal PSA for a man who's aged 75 is going to be up to 5 nanograms per milliliter, while a 50-year-old man's normal range is up to 3 nanograms per milliliter. So then there's another test called the free PSA, free or unbound PSA. And what this test does is it compares the amount of free or unbound PSA in the blood, meaning it's not bound to any proteins. And we're going to compare that free or unbound PSA in the blood to the total PSA level. This test can be helpful to further evaluate a man with a PSA level between 4 and 10 nanograms per mil, without always having to just right away go to a biopsy, which is obviously a more invasive procedure. So if the free or unbound PSA level is below 10%, then the individual would then be a candidate for biopsy. If the free PSA is above like 25%, then this generally means the individual is likely to have a benign condition. So your patient may get a PSA level, and then they may also get a free or unbound PSA level. Another test that relates to the PSA is PSA density. This test compares the PSA level to total prostate volume, and it is conducted via a transrectal ultrasound. Higher density is more concerning for prostate cancer. For example, if the individual has a smaller prostate with a higher PSA level, that's a higher density and more concerning for prostate cancer than if it were low density. Another test is the digital rectal exam. This examination of the prostate can help the MD detect abnormalities such as asymmetry, firmness, induration, or nodules on the prostate. Now, this examination is only applicable to a portion of the prostate that can be felt upon digital examination, so it is not always going to detect prostate cancer. It's more used as a screening tool. The actual test that we use to diagnose and to definitively say this patient has prostate cancer is the prostate biopsy. So this test would be indicated when the PSA level, the free PSA, or the PSA density, or all of those, or a digital rectal exam indicate that cancer is likely. The test can be performed in one of two ways. One is a transrectal approach, and one is a transperineal approach. So the transrectal approach involves a needle being passed through the rectum, like into the rectum, through the lining of the rectum, and into the prostate. One drawback to this procedure, as you can probably guess, is the risk of introducing bacteria and fecal matter into the prostate, which obviously huge infection risk here. Now that transperineal route is becoming more common due to the lower infection risk, and I saw a study that stated it had greater accuracy. So in this procedure, the needle passes through sterilized skin of the perineum and then into the prostate, avoiding the rectum altogether. Both techniques are performed as outpatient procedures and in many cases, just using local anesthesia. So that was the prostate biopsy. Next, we'll dive into how the condition is treated and key patient education.
Ryan Reynolds here for, I guess, my 100th Mint commercial. No, don't. I mean, honestly, when I started this, I thought I only have to do like 4 of these. I mean, it's unlimited premium wireless for $15 a month. How are there still people paying 2 or 3 times that much? I'm sorry, I shouldn't be victim blaming here. Give it a try at mintmobile.com/save. Whenever you're ready.
$45 upfront payment equivalent to $15 per month. New customers on first 3-month plan only. Taxes and fees extra. Speed slower above 40 gigabytes. See details.
So that next letter in the latte method is another T, and that stands for treatments. So the good news is there are several treatment options available for prostate cancer. Treatment is going to be based on the stage of cancer and whether or not it has metastasized. In some cases, in very low risk prostate cancer, the treatment is watchful waiting because it is such a slow growing cancer. The patient will be carefully monitored for signs of disease progression. Now, when we look at more invasive or more active or aggressive treatment options, we're looking at radiation, androgen deprivation therapy, or ADT, chemotherapy, immunotherapy, ablation therapy, and prostatectomy. See, I told you there were quite a few treatment options. We're going to go through the highlights of each of these. So first, let's talk about radiation. There are 2 types of radiation utilized for prostate cancer: external beam radiation and brachytherapy. So external beam radiation is generally conducted 5 days per week for up to 8 weeks. That's a pretty significant schedule. And this is the type of radiation that we tend to think of when we think of a patient undergoing radiation therapy. They go into the radiation suite. There is a radiation machine that aims the beam at the body part that requires radiation, and the machine is turned on, and then the patient goes home. And then they come back and they do it all over again for a period of, again, about 8 weeks. I've actually got a whole episode about external beam radiation. If you want to learn more about that, you should check that out in episode 270. That's episode 270. And then the other type of radiation that I mentioned is brachytherapy. And brachytherapy involves delivering radiation directly into the prostate. High dose rate, or HDR, brachytherapy involves the placement of thin radioactive tubes, so they're very thin, and these are placed into the prostate while the patient is under anesthesia. Doses are delivered for a short period of time, like a few minutes, and they're very high doses, so we don't have to do them for a long period of time. And in most cases, the tubes are removed, the patient goes to recovery, wakes up, goes home. In some cases, I have seen patients who are getting HDR on consecutive days, and when that occurs, then I will see the tubes left in place overnight. Most of the time, though, they're removed, and then when the patient comes back later for their next treatment, they're inserted again. Now, because the radioactive source, which is those tubes that were inserted, because that radioactive source is removed at the end of treatment, the patient is not radioactive after the procedure. And then there's low dose rate, or LDR, brachytherapy. And this involves the implantation of radioactive seeds directly into the prostate. The seeds are left in place, and they do slowly emit low doses of radiation over a period of months. So the good news is they're emitting radiation to the cells that they're trying to damage, but the patient is also emitting low dose radiation. So precautions may need to be followed, such as limiting contact with young children and pregnant individuals during this time period. Now, another treatment option is called androgen deprivation therapy, or ADT. And this option involves lowering blood testosterone levels through surgery or pharmacology. The surgical procedure is called a surgical orchiectomy, and this is the removal of one or both testicles. You may hear this called surgical castration. Medical orchiectomy is achieved with administration of a few different medications. There's a few different options available, and you may hear this called medical castration therapy. So let's look at some of the medications that are utilized. luteinizing hormone releasing hormone agonists, or LHRH agonists. I'll say that again, luteinizing hormone releasing hormone agonists. These medications lower the amount of testosterone produced in the testicles. You may also see these called gonadotropin-releasing hormone agonists. Now, depending on which drug is utilized, they may be administered once a month or once every 6 months via injections or small implants placed under the skin. When first initiated, these medications cause a tumor flare, where testosterone levels increase for a short period of time. You may also hear this called a testosterone or a hormone surge. Now, this may cause men who still have a prostate to have some side effects like difficulty urinating. If the individual has bone metastasis, they may experience bone pain because of this. And if the cancer has spread to the spine, difficulties such as intense pain and even paralysis can occur. Now, another type of medication is an LHRH antagonist, or a luteinizing hormone-releasing hormone antagonist. And these tend to work faster than the agonists do to decrease the production of testosterone, with the added benefit of not causing that surge of testosterone or that tumor flare. Now, these medications work by binding to gonadotropin-releasing hormone receptors in the pituitary gland, which causes a decrease in the amount of luteinizing hormone, which in turn decreases the amount of testosterone. There is an oral medication in this category that is taken once per day, and then there is a subcutaneous option, which is injected every 28 days after an initial loading dose is administered. Now, these medications are typically reserved for treating advanced prostate cancer, and a key consideration with the oral medication is that it can prolong the QT interval. So patients should have an EKG conducted prior to initiating therapy and periodically throughout treatment. And you'll notice I didn't even try to pronounce any of these drugs. I'm not going to lie, I got a little Botox and it's making it hard for me to move my mouth in the exact right way. And I know better than to try to say something really difficult. So I did not attempt to say these, but they are in the blog version of this episode. So you can go to my website, search for prostate cancer, and you'll see them there. All right, there are some other medications used in the treatment of prostate cancer. One of them is called abiraterone. I tried that one. I have no idea if I got it right, but it goes by the brand name Zytiga, and it blocks testosterone synthesis and is utilized in men with metastatic prostate cancer that is not responsive to other types of hormone therapy. When prostate cancer is not responding to that ADT therapy, you might hear this called castration-resistant prostate cancer. And then there's another medication. I'm just going to try it. Enzalutamide, which goes by the brand name Xtandi, and it is also indicated in patients who have castration-resistant prostate cancer. Also in patients with metastatic prostate cancer or in individuals at high risk for metastasis. And then another one, docetaxel, goes by the brand name Docivix, if I got that right, hooray. It is an anti-neoplastic medication utilized along with prednisone for metastatic castration-resistant prostate cancer. So those are just some of the medications that you might see. Again, they were LHRH agonists, also known as gonadotropin-releasing hormone agonists. And you know what? I'm going to try to say these drug names anyway. Botox be darned. All right, so for the LHRH agonists, we have a drug called Luprolide, which goes by the brand name Lupron, and another one is Goserelin, which goes by the brand name Zoladex. Remember, these are the medications that can at first cause that surge of hormone or a tumor flare, which can cause some complications. And then there are the LHRH antagonists. And remember, these tend to work faster than the agonists or the ones I just mentioned. And these also decrease the production of testosterone. They do not cause that tumor flare or hormone surge. One of these is called relugolix, which goes by the brand name Orgovix. That's that oral medication. Remember, I talked about the oral medication causing possible QT prolongation. So the patient's going to need an EKG before starting this med and periodically throughout. And then the other is degarelix, which goes by the brand name Firmagon. And this is the one that is administered via a subcutaneous injection every 28 days. All right, so I guess those weren't as hard as I thought they were going to be. I was a little nervous about it, but I think I did okay. While I can't go through every side effect of every one of these many medications because that would be really boring and you're not going to remember it, I'm not going to remember it, but some general side effects are things like weight loss, sexual dysfunction, osteoporosis, bone fractures related to osteoporosis, hot flashes can occur, decreased size in sexual organs can occur, lack of energy, and increased risk for diabetes. So that was the category of androgen deprivation therapy and then a few other medications. Next, we have chemotherapy. Chemotherapy is utilized to stop or slow the growth of cancer cells and is often used when ADT is not effective or when the cancer metastasizes. The most common chemotherapeutic agent used for prostate cancer is docetaxel, which is administered via an IV infusion. General side effects of chemotherapy apply and include things like weight loss, nausea and vomiting, alopecia or hair loss, and increased risk for infection. And then we have immunotherapy, which is a really interesting treatment option. This is a newer approach to prostate cancer treatment, and these therapies use the patient's own immune system to slow or stop the growth of cancer cells. Two general approaches are a cancer vaccine and immune checkpoint inhibitors. So let's first talk about the cancer vaccine. Provenge is the name of a cancer vaccine that boosts the immune system so that it can attack those prostate cancer cells. It is generally used to treat advanced prostate cancer that is resistant to hormone therapy. Each vaccine is made specifically for each individual by taking white blood cells from the patient and mixing them with prostatic acid phosphatase, or PAP, which is a protein in prostate cancer cells. This mixture is then administered back to the patient via an IV infusion for a total of 3 doses. Note that this therapy does not cure the cancer or completely stop the cells from growing, but it can prolong life. Side effects of this cancer vaccine include fever and chills, fatigue, nausea, headache, and joint pain. And then we have immune checkpoint inhibitors. Now, the immune system uses these checkpoint proteins. Every now and then it comes across one of these checkpoint proteins, and the purpose of them is to keep itself from attacking the body. Cancer cells are pretty smart, and they also use these checkpoints to prevent the immune system from attacking them. So medications that target checkpoints inhibit them so that the cancer cells can be susceptible to attack by the immune system. Patients receive these medications via IV infusion about every 3 to 6 weeks. Side effects can include fatigue and nausea, diarrhea, and decreased appetite. So that was 2 types of immunotherapy: cancer vaccine and immune checkpoint inhibitors. And then next we have ablation therapy and prostatectomy, both of which are kind of surgical in nature. So let's talk about ablation therapy first. Ablation therapy selectively targets specific areas of the prostate tissue using various modalities to destroy those cancer cells. These procedures are done under anesthesia or a spinal block, and most men go home the same day. So we have cryotherapy, lasers, ultrasound. Let's talk about all of these. So, cryotherapy uses very, very, very cold temperatures to freeze prostate cancer cells, basically destroying them. One drawback of this procedure is the risk for damage to nearby nerves, which can lead to erectile dysfunction. Another type of ablation therapy is focal laser ablation. And this involves using MRI guidance to insert a thin laser tube or a thin laser fiber, rather, into the prostate. Once in place near that tumor, the laser is activated to heat up and destroy that target tissue. There's also ultrasound called high-intensity focused ultrasound. And this uses ultrasound beams, obviously at very high intensity, to heat and destroy the tissue. In this procedure, a probe is inserted into the body via the rectum, and high-intensity ultrasound beams heat up and destroy that target tissue. There's also transurethral ultrasound ablation. Now, this is similar to that high-intensity focused ultrasound I just talked about, except in this procedure, the probe is inserted through the urethra and then into the prostate. And then there's photodynamic therapy, or PDT. This one's really cool. This involves the IV infusion of a light-activated drug. Once the drug is administered, a light source is then inserted into the prostate and directed at the tumor. This light activates the medication, which causes the blood vessels around the tumor to be destroyed. And without a blood supply, the tumor is hopefully not going to survive. Note that this procedure is not yet available in the United States for the treatment of prostate cancer. It is used for other types of cancer, so it is possibly something you will see in the near future. And then our final treatment option to discuss today is prostatectomy. Patients whose cancer show signs of progressing or spreading to other parts of the body may have the prostate removed in a surgical procedure called a radical prostatectomy. In this procedure, the entire prostate is removed through several small incisions in the abdomen, and that would be called a laparoscopic procedure, or it could be removed through one larger incision that basically goes like from the umbilicus to the pubic bone, and that would be an open procedure. Now, since this procedure does involve reattaching the urethra to the bladder, most patients will have a urinary catheter in place post-operatively for several days, maybe even up to 14 days, until the urologist is confident the bladder has healed. Complications of prostatectomy include incontinence and erectile dysfunction, though the risk for these is less with a nerve-sparing approach. So some surgeons may use what is called a nerve-sparing approach. Other complications, of course, include infection, which is always a problem, or a possible complication after surgery, and then urethral strictures can occur, which can impede the flow of urine. So now we are here at the final letter of our latte method, and that is an E, and that stands for education. So what are we going to do to educate our patient about prostate cancer? So obviously, education is going to vary widely depending on what treatment options are being utilized. As for prostate cancer screening, teach your patient that screenings are recommended starting at age 50, though men who are at higher risk would benefit from screenings beginning around age 40 to 45. Some other things to teach your patients include that pelvic floor exercises can help with urinary incontinence or urinary dribbling, which can occur prior to treatment and can occur because of some of the treatments we're doing. Patients receiving chemotherapy should be taught infection prevention measures, such as diligent hand washing, avoiding crowds, and receiving all recommended immunizations. Patients receiving chemotherapy should also be taught to double flush the toilet with the lid closed. We don't want anything splashing out. And they should definitely use a separate toilet in the household if one is available. Caregivers of patients who are receiving chemotherapy should double glove anytime they're coming into contact with body fluids and then wash their hands immediately afterwards. In addition, all clothing, all bedding that the patient with prostate cancer who's going through chemotherapy is using should be washed separately from other laundry in warm water. Disposable items such as incontinence pads or briefs, adult briefs, should be sealed in 2 plastic bags before being thrown away. Now, for patients receiving surgery or invasive procedures, you want to make sure you reinforce the discharge teaching provided by the surgeon. This can include things like lifting restrictions and certain medications they'll need to take. Patients with those implanted seeds for brachytherapy need to understand that the seeds will cause them to emit radiation for a period of time, and that it can take a long time, like up to 10 months, for the radiation to fully dissipate. They should follow their physician's recommendations for avoiding close contact with children and pregnant individuals during this time, and they'll let them know what time frame that is. Implanted brachytherapy seeds can also, not always, but can set off airport security alarms. So let the patient know they should get a card or a letter from their physician that they can show to airport security if needed. And then patients receiving external beam radiation can have really irritated and sensitive skin at that site. They should use mild soap and warm water to clean the skin and then just pat dry. Don't rub the skin dry. Moisturizers can and should be used to help soften the skin and keep it intact. We don't want it getting dry and cracked, which can lead to infection. Patients should also avoid chlorine pools, as well as extremes in heat or cold, such as ice packs, saunas, and hot tubs. So there you have it, your quick, 34-ish minute overview of prostate cancer. Lots to learn about this condition because there are just so many different treatment options available. And again, if you want to dive more deeply into external beam radiation, that is episode 270. And I'll probably do an episode coming up in the not too distant future on brachytherapy because there's a lot more to it than what I covered in this episode. I did give you the highlights though, so you can kind of keep an eye out for that as well. So I will see you back here soon. And in our next episode, we're going to be diving into a very serious endocrine disorder. So I'll see you back here next week for that. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Did you know using your browser in incognito mode doesn't actually protect your privacy? Take back your privacy with IPVanish VPN. Just one tap and all your data, passwords, communications, browsing history, and more will be instantly protected. IPVanish makes you virtually invisible online. Use IPVanish on all your devices, anytime you go online at home and especially on public Wi-Fi. Get IPVanish now for 70% off a yearly plan with this exclusive offer at ipvanish.com/audio.